This is my continuing coverage of the health care bill. This is part number 67. And we are on page number 58 where we're talking about functions. An exchange shall, at a minimum, implement procedures for the certification, recertification, and decertification consistent with guidelines developed by the Secretary under subsection C of health plans as qualified health plans. Okay? Now, what this means is that, first of all, the exchange has to determine whether this health care plan that you're going to pay for is a qualified health plan. And then, every year or so many number of years, I'm not exactly sure exactly when, but every so often, the health care plan has to once again be considered by the exchange to see if it's still a valid health care plan or not. And if the exchange decides that this health care plan is not a valid government health care plan, then it says, okay, you can't be listed on our exchange anymore. Okay. So, now to put that all in a nutshell for you, and I know you're sitting there going, man, I'm still a little bit confused. Okay. Let's say we've got things like United Healthcare, you've got Blue Cross Blue Shield, and let's say you have another one that says it's ABC Insurance. Alright. Now, we all know that United Healthcare is in compliance with the rules of the Affordable Care Act. So the exchange lists United Healthcare on the exchange. Says, hey, this is one of the plans you can choose from. Well, we all know that Blue Cross Blue Shield is completely compliant with the Healthcare Act, okay, this healthcare law, this Affordable Care Act. So, of course, the exchange says, okay, we'll list you as a choice for people buying health insurance. Now, let's say that the ABC company says, hey, we're compliant. But the exchange goes out there, takes a look at their plan and says, hey, this is not a government-compliant health care plan. Well, then the exchange says, I'm not listing you as a government-compliant health care plan because you're not complying with the government. Does that clear it up for you? I hope so. An exchange shall, at a minimum, provide for the operation of a toll-free telephone hotline to respond to requests for assistance. In other words, the exchange, this healthcare exchange, outsources to a telephone service company. We had one here in Decatur called StarTech, okay? And these telephone operators answer your questions about health insurance. That's what they're there for. All right. An exchange shall, at a minimum, maintain an internet website through which enrollees and prospective enrollees of qualified health plans may obtain standardized comparative information on such plans. So this healthcare exchange is going to have a website. And you'll go to the website and you can compare plans between United Healthcare and Blue Cross Blue Shield and ABC Company if they are found to be compliant. See what I mean? And you guys all know how to use the internet, so there you go. If you're watching me, you do, anyway. An exchange shall, at a minimum, assign a rating to each qualified health plan offered through such exchange in accordance with the criteria developed by the Secretary under subsection C3. And that means that these healthcare programs are rated. Are they very good? Are they not so good? So on and so forth. An exchange shall, at a minimum, utilize a standardized format for presenting health benefits plan options in the exchange, including the use, of the uniform outline of coverage established under Section 2715 of the Public Health Service Act. Well, if you guys want to go to Section 2715 of the Public Health Service Act, you are more than welcome to do so. If I am asked to do so, I will do so. But I'm going to kind of leave that one up to you. If you guys do it, let me know. I'll tell everybody where to go, and then they can watch your video. Otherwise, I'll do it myself. Okay? So, what they're meaning is that the exchange has to show you a way to compare the plan between United Healthcare and Blue Cross Blue Shield and ABC Company. That way you can compare them very easily and not be confused by all the facts. Alright. In accordance with Section 1413, inform individuals of eligibility requirements for the Medicaid program under Title 19 of the Social Security Act. Okay, now what that means is that this website, this exchange website, has to tell you how poor you have to be in order to be slapped on a Medicaid. Okay. The CHIP program under Title 21 of such act, or any applicable or state or local public program, and if through screening the application by the exchange determines that such individuals are eligible for any such program, enroll such individuals in such programs. So, in this case, if the exchange figures out that you are eligible to be a part of the Medicaid program, then the exchange will enroll you in the Medicaid program. They'll take you through whatever steps you have to go through to enroll in Medicaid. Isn't that nice? Okay. Then the exchange has to establish and make available by electronic means a calculator to determine the actual cost of coverage after the application of any premium tax credit under Section 36B of the Internal Revenue Code of 1986. And if you guys want to look up Section 36B of the Internal Revenue Code of 1986, you are more than welcome to. Let me know what you find. And any cost-sharing reduction under Section 1402. What that means is that when you're on this wonderful exchange, and I don't know what happened to my calculator, but I have one. Yeah. Ah, here it is. This is my calculator right here. I have a TI 80 calculator. Well, when you try to apply over the internet with this healthcare exchange, you won't need that TI 80 calculator. They'll just have one on the screen for you. You can just punch your little buttons with your mouse, and then you can make all your calculations there. That way you don't have to figure it up on your calculator at home and hope the heck that the batteries in your calculator are actually working. Okay. Alright. Subject to Section 1411 of the Affordable Care Act, like we have ever gone through it yet, but we will, grant a certification attesting that for purposes of the individual responsibility penalty under Section 5000A. Now notice this is talking about individual responsibility penalty. This means that you decided you didn't want to buy any health insurance despite the fact that they told you you do it or you're going to get penalized. You decided you didn't want to do that. Well, this Section 5000A will tell people what's going to happen to them if they don't buy health insurance despite the fact they were told to do so. Of the Internal Revenue Code of 1986, an individual is exempt from the individual requirement or from the penalty imposed by such section because there is no affordable qualified health plan available through the exchange or the individual's employer covering the individual. Now what that means is, let's say that they have United Healthcare on the exchange, they have Blue Cross Blue Shield, they have the ABC Company, but all these companies are charging too high a premiums for this person to ever afford. Even with tax credits, they can't afford this. Well, then they're not penalized for not getting health coverage. Now, let's say an individual is getting their health insurance from the company they work for. Well, they don't have to go on the exchange because the company they work for is providing their health insurance. Okay? So they don't pay a penalty for not going through the exchange. The individual meets the requirements for any other such exemption from the individual responsibility requirement or penalty. Transfer to the Secretary of the Treasury a list of individuals who are issued a certification under subset paragraph H, including the name and taxpayer identification number of each individual, the name and taxpayer identification number of each individual who was an employee or an employer but who was determined to be eligible for the premium tax credit under Okay. So, are we getting the idea here? Alright. Well, anyway, I'm going to stop my video right here, and I'm going to talk about a couple things in my next video. If I said to you that this was Healthcare Bill Part 66, it's really Healthcare Bill Part 67. I'm sorry about that. Anyway, I will cover more in my next video, so I want you to stay tuned.